the link between osteoporosis and fractures is very complex, but from a very simple way to understand it is that if you have something that becomes brittle and weak over time, and the overall structure wears out. So imagine there's a column of concrete and the waves are washing it away and it becomes more porous and it takes away the mineral. Then that becomes weaker, and so instead of a nice, solid, strong column, you have something that's a little shaky, a little weak, and it's porous, meaning there's holes in it. And so if something were to strike it hard enough, it'll collapse. And so that is a simplistic way of understanding how the strength is affected with osteoporosis. Now, it's not just about the mineral content, there's other aspects of the biology of the bone, but again, from a simplistic understanding, that's really what's happening. And stress fractures also may be related to that. Now, stress fractures, for example, the athlete, the female athlete triad, which is well understood, but still very complex. What happens is when you have a woman who's an athlete who has amenorrhea, so it's almost as if she's in a postmenopausal state, results in bone loss. Again, the balance is shifted, and you can end up with a stress fracture. And then you can have stress fractures just from overuse. So the military candidate who's marching, ends up with stress fractures because of overuse. So there's a lot of causes for stress fractures, but fragility fractures, where the underlying foundation of the bone is weak, where the strength is disrupted, that becomes a big phenomenon that is really an epidemic right now.